In 2012, Children's Mental Health Ontario's Youth Action Committee created the Speak Up, Speak Out project. We wanted to find out from youth across Ontario how they thought their schools could provide a more supportive environment for youth struggling with mental health and addiction issues. We created a policy paper that outlines the issues youth with mental health and addiction issues are facing in schools and recommendations on how to provide them with better support. Students felt strongly about the importance of having a designated space that would allow a safe retreat for them to go if they are experiencing difficult to manage mental health symptoms, where they are not on display in front of their peers. This video will show you what a safe space could look like in your school, different ways it can be implemented, and barriers that you might face, and some solutions to those barriers.
A safe space to me is an easily accessible, judgment-free zone.
It's a very relaxed and comfortable environment.
Space within a school where you can go and just step away from the normal stresses of your day.
Be stocked with arts and craft supplies and like Play-Doh and journals and stuff as quick de-stressors for students when they're there.
It's for students and by students.
It is a space that's available for all students, for whatever they might need.
It's a place where people can feel free and relaxed and that they belong.
Space where students can go when they're feeling overwhelmed instead of just skipping class.
We are now going to give you 3 examples of how you can implement a safe space into your school.
One kind of safe space that you can implement within your school is called a quiet space. A quiet space is a place where students can go and just breathe. It's not necessarily a place for conversation to happen, rather a place where a student can go, sit, listen to some music, de-stress, and just take those few minutes that they might need to get through the rest of their day. A quiet space is a space that should always be available to students whenever they might need it. It doesn't necessarily require constant supervision, but you might have a teacher in there during the prep or marking some papers, or you might choose to put it beside a guidance office or a classroom, so that there is someone there and you do know who's using the quiet space, but they don't necessarily have to go talk to the student or have the training to do so.
One of the safe spaces we are suggesting for implementation in schools is called the peer-to-peer safe space. Now, this is a place for conversations to happen between students and whatever adult supervision would be in the room. This room would need to be monitored by an adult just for students' safety if ever a crisis were to occur. Sign-in and sign-out sheets would be used to help monitor where students are and again to ensure their safety. We also realized that supplying supervision for the room daily would be quite difficult for a lot of schools, so we're suggesting that the room be available maybe once or twice a week at regulated hours, but that the students are aware when this space will be available for them.
One of the challenges you might face is that your school may be hesitant to give you a permanent space, but instead a space where you can only occupy for an hour or two.
It can be as easy as buying a hockey bag and purchasing items from the dollar store.
For example, a hockey bag filled with things like mental health resources and relaxing activities like puzzles or yoga mats.
And this is a very inexpensive way to provide a space if you're unable to rent a room or make sure there's a physical space available for students.
When interviewing principals and discussing their opinions on safe spaces and if one were to be implemented in their school, their biggest concern was the liability of the school when the students are using the room.
Primarily, the principals were concerned with their students' safety and whether or not students would be self-harming in this room.
However, there are already unmonitored rooms in schools that make it possible for students to self-harm. Rooms such as washrooms, change rooms, and unattended hallways and stairwells. If this room were implemented, it would offer the students a place to go when feeling overwhelmed, and quick de-stressors as well as a chance to open up about how they're feeling.
Another concern that was discussed was what to do if a student was in crisis or having a panic attack.
One principal had suggested that there always be a staff member in close proximity of the room to monitor when students are in there and be close by in case of emergency. However, schools should already have some sort of protocol in place for students in crisis regardless of the space implemented or not.
We also spoke about lack of staff availability for proper supervision of the space.
One of the principals had suggested that opposed to having teacher supervision at all times, they could look into accessing EAs for supervising the space. They could also put the space near a room that already has constant supervision, like near the staff room or the guidance rooms if available. If not, hall monitors could always have routinely walk-bys.
I'm always here and always will be.
For the most part, there wasn't a whole lot of concern around students taking advantage of the space. However, if that were to occur,
it was suggested that the school have some way of monitoring when and who is in the room. This could include sign-in and out sheets or teacher notes to ensure student safety. If a student were to be in the room a number of times throughout a week, the school administration could offer them local professional guidance.
Telling you that it's alright, you're okay.
A smaller concern was the money and resources involved with the space and also space availability in the schools.
We had discovered that the board has money set aside for mental health research. The school could inquire the board about accessing some of this money to fund their space.
Always here.
So I know you've heard about different barriers and ways to overcome them, but what about the barrier of simply not having space for a room? I know what you're saying. You can't make space where there is none, which is totally understandable because the laws of physics don't allow for that.
But wait, remember earlier we were talking about the idea of a portable safe space? This way, the portable space can be transported to different locations with not too much work at all. Take the portable space to an unused classroom. Take it to a group of chairs. Take it to the library or cafeteria. That's the beauty of a portable safe space. You can literally make anywhere a safe space.
Another idea to put to you is to look again. I know that there's some rooms in schools that are used for a very specific purpose but aren't used very often. For instance, are you from a Catholic school? I know in my Catholic high school there was a chapel that was used, but not very often, and this would have made for a perfect safe space for students. Lastly, is there a classroom or a portable that's not being used for a certain period on certain days of the week? That's great. Is there a guidance counselor or a mental health lead that's willing to give up their office for, maybe a few hours each week? Perfect. Now just grab some chairs and there you have your safe space.
While the world was hurtling forward, as got stuck standing still.
For support, the first point I'm going to talk about is identifying key players, such as specific teachers and students. In regard to teachers, looking to see if there are any guidance counselors, religion teachers, phys ed teachers, teachers who self-identify as having mental health or who are supportive of it can be helpful, as well as some schools have social workers, youth workers, and mental health workers. In regards to mental health workers, sometimes mental health organizations partner with schools so they can be supportive in looking at what information they have done already. This needs to be student-driven. This is for students and by students. It's important to have student voices as this is something that will impact them and will be a service they can use. When students feel their voices are being heard and that they're making a difference, they feel empowered.
I can see through the glass. Maybe I'd understand why things got so hard.
A final potential barrier in creating a safe space in your school is the potential for experiencing stigma both from other students and from teachers. It's important to remember and acknowledge that everyone has mental health and everyone can take care of their mental health in a space like this. Therefore, try to avoid names that include mental illness or diagnostic terms, and instead go towards things that promote wellness, like the wellness center or the quiet room or even safe space. Another potential barrier in creating a safe space in your school related to stigma is understanding and respecting student privacy. This involves being mindful of where resources are located in your school, because Having it in a high traffic area, for example, may be the barrier between students wanting to accept those services and receive them, as opposed to ignoring them for fear of being judged or stigmatized. Avoid high traffic areas like cafeterias or front entrances, and maybe go for quieter areas such as libraries or chapels. It's also a good idea to put some information online on your school's website or other well-known resource online so students can access them when they're at home and by themselves. A final potential barrier in creating a safe space in your school related to mental health stigma is making sure that teachers are aware of what a safe space means and how to best support their students who are choosing to use this space. Not outing students in class for using the space or that they go often, because this is disclosing information about them that they might not want to be revealed. Furthermore, teachers should just be aware of how to speak about mental health, not try to talk down to students who they think might be mentally ill, because this is also very stigmatizing and may discourage students from using a safe space.
Slightest movement of her limbs.
Thank you for taking the time to watch our video. We will continue to post videos for professionals and students on how to implement recommendations from our report. Our report can be found at kidsmentalhealth.ca. Share your ideas on how to create a safe space on our Facebook and Twitter.